Urinary incontinence causes a rather disabling problem for the health of those affected, as it negatively affects daily activities. Let's find out better what it is in today's video. Hello and welcome to Med for Care. Today's topic is urinary incontinence. This is a clinical condition that causes involuntary urine leakage from the urethra. It is a disease that mainly affects women, in a double percentage compared to men. A transient cause is related to pregnancy and childbirth. In the elderly population, the exact estimate is not easy to evaluate, as it happens that the elderly often does not report the presence of the problem. However, it is believed that more than half of elderly people living in retirement homes, nursing homes, or receiving home care suffer from incontinence. In men, one of the causes of urinary incontinence is linked to prostate surgery. There are different types of urinary incontinence which differ from each other based on the mechanism that causes them. The main types are the following. Urge urinary incontinence, caused by hyperactivity of the detrusor muscle of the bladder, which expels urine into the proximal entrance of the urethra. This type is often accompanied by a sense of urinary urgency. Stress urinary incontinence, which consists of the involuntary emission of urine following an effort that increases abdominal pressure, such as a cough or sneeze. This type mainly concerns young women who have just given birth or are waiting to give birth. Functional urinary incontinence, which occurs when a person has no organic alterations but does not want to reach the toilet. It occurs mostly in individuals suffering from psychiatric disorders. Spillover urinary incontinence, caused by bladder obstruction or when the bladder detrusor muscle does not contract sufficiently. In men, this type of incontinence is often caused by benign prostatic hyperplasia or tumors of the prostate or bladder. In other cases, urine leakage may be the result of a weak or too relaxed pelvic floor and a sudden increase in intra-abdominal pressure, which, by compressing the bladder, induces the emission of urine. Very often, urinary incontinence is the final consequence of a clinical condition, which can be heralded by symptoms of the lower urinary tract, also known as LUTS. Lower urinary tract symptoms. LUTS that can occur with urinary incontinence are plakiuria, which consists in the more frequent emission of urine during the day, nocturia, with involuntary emission of urine during night rest, sensation of incomplete emptying of the bladder, post-void dribbling, where the person passes urine and drops after urinating. The initial evaluation of a suspected or confirmed state of urinary incontinence cannot ignore a complete urological examination, with anamnesis and objective examination of the patient. During the anamnestic interview, the patient must take care to inform the urologist about the presence of respiratory diseases or cardiovascular system diseases. In fact, many respiratory pathological conditions can manifest themselves with coughing fits that cause an increase in intra-abdominal pressure, while cardiovascular pathologies can lead to fluid overload and an increase in diuresis. During the physical examination, the doctor inspects and palpates the cervicothoracic district, looking for signs of jugular distension or edema, the region of the lung fields and the abdominal region. Naturally, the genital region, testing for the presence of pelvic organ polyps or prostatic hypertrophy. In men, since prostatic hyperplasia often causes mechanical obstruction of the bladder, preventing the physiological phase of depletion, a screening test has been developed for the classification of prostatic symptoms. This test, called IPS, International Prostate Symptom Score, examines 7 aspects of urination, possibly correlating them to the presence of a significant hypertrophic state of the prostate gland. The diagnosis of urinary incontinence is initially based on the chemical, physical, and morphological examination of the urine. Afterwards, a cystoscopy may be necessary, which involves the insertion of a thin flexible tube equipped with a camera inside the urethra, up to the bladder. There are other diagnostic tests such as Voiding cystourethography, which studies the morphology and functionality of the bladder and urethra after administration of a contrast medium. And finally, the urodynamic test, which studies the muscular and nervous functionality of the bladder. Urinary incontinence can be treated with exercises to strengthen the pelvic floor muscles. Kegel technique is one of the best-known exercises. It involves the sequential contraction and relaxation of the muscles of the pelvic floor in order to increase the force of expulsion of the residual amount of urine trapped in the urethra. In addition to exercises, urethral bulbar massage is useful. It must be carried out after urination and involves self-massage of the scrotum towards the bulbar urethra. The aim is to encourage the escape of residual urine towards the external urethral sphincter. Pharmacological therapy, if associated with the execution of pelvic floor muscle exercises, can bring benefits. Most often, anti-muscarinic drugs are administered, like those capable of reducing the abnormal contraction of the bladder and phosphodiesterase 5 inhibitor drugs. In conclusion, urinary incontinence is a very frequent clinical condition, often not well sized in terms of actual frequency, especially in the elderly. It is important to evaluate incontinent patients and administer appropriate therapies in time in order to avoid some urological complications, such as infections and renal dysfunction. We have now reached the end of today's video. We hope you liked it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video of ours comes out. See you soon on Med for Care.